Welcome to Webinar Wednesday, everybody. Good to see you all. This is the last of the series that's on our website right now, but I have some really exciting and good topics coming up. So that flyer should be ready very soon, and I'll get that out to all of you. But I even have all the way scheduled to like January right now, so it's super exciting. But we have some really good ones. But yes, Aly's going to be great today too. So Aly is a certified brain injury specialist, and she is the director of occupational therapy and activities at Dakota Alpha, which is North Dakota's only skilled nursing facility that specializes in brain injury rehabilitation. She earned her master's in occupational therapy from UND, University of North Dakota, as well as a PhD in educational foundations and research. Aly is a proud fifth-generation North Dakota farm girl, an advocate for mental well-being and heart health through her volunteerism with the American Foundation for Suicide Prevention and American Heart and Stroke Associations. So we're excited for you to present to us today, Aly.
Awesome. Thank you for having me. And I hope everyone can hear me okay.
Yep, you're good.
Awesome. So that's the most important part before you start a webinar, is making sure everyone can hear you before you start talking. But thank you again for that intro, Carly. Before getting into our topic today, I do want to share a little bit of information on my background as an occupational therapist. I'm working with clients, patients, and residents recovering from mental health problems and disorders. So my first career took me to Minnesota's Community Behavioral Health Hospital, which were the efforts of actually deinstitutionalizing patients with mental health disorders from their state hospital facilities. So they were closing a lot of those regional treatment centers and opening smaller facilities in people's communities with the goal of less time in the hospital, more time in the community with support. So as a care coordinator and treatment planning champion of our program, I had the unique experience of working with patients, typically who were experiencing a mental health crisis, to stabilize or improve their mental health by gaining the necessary coping skills and supports to return to the community. And we ran an evidence-based program called Illness Management and Recovery. So through this experience, I came to appreciate even more the importance of person-centered care and treatment planning, and how mental health shouldn't just be something that we're concerned about during a crisis, but actually at all times. It's an integral part of our overall health and well-being. So when I moved back to North Dakota, I carried this mission and this excitement regarding mental health promotion. And I spent some time working for the North Dakota Tobacco Quit Line, so doing some quit line counseling for addiction. I taught occupational therapy students at UND and then at the University of Mary, and then spent some time working at CHI, St. Alexius Health, and I worked in education, inpatient physical disability, and also in the inpatient psychiatric unit. And currently I've been at Dakota Alpha for almost 5 years. And as Carly already mentioned, and some of you may already know, we are North Dakota's only skilled nursing facility specializing in brain injury rehabilitation. And we have 20 beds here. And then we also have a basic care program, 10 beds there as well for residents. And then I've been a certified brain injury specialist for a little over a year now. So I'm very happy to be with you today. And I recognize that the audience may include survivors of a brain injury, people that work in facilities, people who do outpatient therapy or care with survivors, but also maybe some caregivers. So I'm going to try to tailor my conversation to each one of those groups, but also keep in mind that if I don't specifically talk about caregivers, I'm also including you as well, or family, or therapists. So away we go. By the end of our time together today, I anticipate being able to achieve these objectives. So defining what is mental health, what are mental health problems, and what's a mental health disorder, and looking at the differences between each one on the continuum, because they're really on a continuum when we're using those terms. Second, describe the impact of mental health in connection with brain injury. So what are those connects? Where are the overlaps? How are they related to one another? Examine interventions for rehabilitation used for mental health problems and disorders with people recovering from brain injury. So whether you work in a facility with survivors, at home as a caregiver, or living in the community with supports, what are things that we need to keep in mind for optimal interventions? And finally, it's important to have an action step. And this is where you will actually develop a list of well-being and self-care strategies for implementation. And this is important, not just when dealing with a mental health problem or disorder, or even a pandemic, which we are all dealing with right now, but at all times for optimal mental health. So, like I said, that last piece is an action step. So let's get started. So first of all, let's talk about this continuum. Like I mentioned, mental health. Mental health problem, mental health disorder, they're all understood on a continuum. According to the CDC, mental health affects how we think, how we feel, and how we act. It also helps determine how we handle stress, how we are doing in relating to others, and also how we are doing with making healthy choices. So when we talk about mental health, we're really honing in on it being actually a state of well-being. This is where we are recognizing our abilities, we are effectively coping with our daily stressors, and we also have this productive engagement in occupations. And as an occupational therapist, I think that's important for me to expand upon that a little bit. Occupations, I don't mean our work, but our occupations are anything that have meaning to us. Maybe they have, they're part of our routine, they're part of our habits, they're things that we engage in on a daily basis. So keep that in mind when I use the term occupation. That graphic on the slide, this is from Peasy and Richards from 2017. And this is where well-being and quality of life are recognized. So we have a confluence of optimal health, the environment, and occupational participation. So as you can see with health, we're looking at the individual, what's their community like, the population in general, and how that impacts quality of life and well-being. The environment, so socially, what's it like, physical environment, and what's the culture of the environment that you're living in. And then also our occupational participation. So what are the occupations? What are the things that we are engaging in? What are the things that matter to us? What are the demands, the skills, routines, and performance required to actually do those things? Okay. So being in a state of well-being actually helps buffer effects of stress, so we're able to cope. It boosts our self-efficacy, and that's the belief in our abilities to achieve. So as you can see, they're all very well connected. And when we use the term mental health, it's not just a simple thing. It's actually very well constructed and thought out. So with the World Health Organization, I included a statement from them from 2018. Mental health is fundamental to our collective and individual ability as humans to think, emote, interact with each other, and earn a living and enjoy life. So it's not just thinking and feeling, and that's just all mental health is, but really it translates into our interactions, it translates into our productivity, and actually the quality of life and the enjoyment that we have. Moving along the continuum, we have mental health problem. So that marks the movement away from optimal mental health, but it's not an actual diagnosed mental disorder, which we'll get to in a little bit. Problems are seen most likely in the form of some emotional distress, feelings of burnout, trauma. And I think that right now, in dealing with a pandemic and thinking about where I work and what's happening in the community, a lot of people are experiencing those symptoms of burnout. They've maybe worked multiple days straight. They're wearing a mask continuously. They're interacting with people that are worried and curious of what's going to happen in the future. So we are seeing perhaps a bit more increase in burnout type symptoms. But just because we're experiencing burnout doesn't mean that we are diagnosing people with mental health disorders. It just means that there's a problem, we're recognizing it, and the first step to dealing with it is actually identifying what's causing the problem. We also, I think it's important to note here, there's emotional issues and behaviors or consequences of behaviors such as feelings of anger, loneliness, sleep issues. So not only do we see, like I said, the problems of distress, burnout, and trauma, just to name a few, but we're seeing some more of those emotional responses and behaviors also. So I would like to share a short clip on the experience of mental health problems. So as you listen to this clip, this is from Mind, and that's a UK-based organization committed to advice, support, and services for people experiencing mental health problems. I'm going to click on that, and I certainly hope it works for you. If not, Carly's on standby for some assistance here.
Yep, I'm here if we need it. I think you got it.
It's a very short video, but it just really, it's just great. So, one second.
I think you have to accept those cookies there.
Here we go. I will scroll down.
There you go. We're just not hearing it.
Okay, you're seeing it but not hearing it. This is a bummer.
So is your, try that sound button right below there?
Yep.
Okay.
If we can't watch it, it's okay. If I can, it's a way that I can make you hear it a little bit better. Let me try it again. If not, we can skip over, but it's just they do a very nice job of explaining what's mental health problem and kind of normalizes mental health and how to cope.
Yeah, still not hearing anything, but.
Okay, so luckily those subtitles helped us out a little bit there, but I just thought the video did just a really nice job of normalizing mental health problems and what you can do to cope. And I think that's so important that we recognize that we all have mental health. How do we keep it optimally functioning? So thank you for bearing with me on the bit of a technical difficulty. Okay, so looking at mental health disorder, this is once again along that continuum. And these include the diagnosable mental illnesses, impacting cognition, emotions.
I'm still seeing your YouTube black screen. You have to close out make the YouTube part smaller. Minimize that screen. There we go. And then hit your display settings so that you're doing presentation mode up in the middle there. There you go. Perfect.
I thought I clicked on that, but apparently it clicked on something else. So I apologize.
Oh, that's all right. You're all good now. Okay. Thank you.
Hopefully I don't have any more video clips, so we don't have to worry about that. Okay, so like I said, we're discussing the mental health disorder along that continuum, including the diagnosable mental illnesses impacting cognition, emotions, behaviors, and this results in some unproductive engagement in occupations. And like I said, bringing it back to occupations, things that have meaning to us, this unproductive engagement, not being able to go to work, struggling to learn new information, not taking care of ourselves, with that mental health disorder that negatively impacts our quality of life and also our well-being. According to the National Council for Behavioral Health, involved with the development of Mental Health First Aid USA, mental health disorders do affect 1 out of every 5 American adults in any one given year. And these also, I think it's important to note that co-occurring mental health disorders are common. So having anxiety and depression, or having depression and substance use disorder. That is very, very common that people experience that. And half of all mental disorders actually begin, or mental health disorders actually begin by age 14. So this is actually something that's showing up as people are transitioning out of adolescence into young adulthood. So that's something definitely important to consider. What we're going to do next is actually talk about some of the more common mental health disorders and the connection they have with brain injury. So keep in mind that mental health disorders are vast, but these are the ones that we see most common. Anxiety is the most common mental health disorder among the general population, and it's also present with some survivors as well. So according to Mayo Clinic in 2019, anxiety is an emotion characterized by the anticipation of future danger or misfortune, along with excessive worrying. It can include behavior aimed at avoiding situations that cause anxiety, and this might also include the generalized anxiety disorder, panic disorder, and phobias. So with this, and because anxiety hinges on emotions and cognition, we see this intersectionality with brain injury. Cognitive processes involving attention may be impaired with difficulty just focusing attention on a task, on what somebody is saying, all the way up to divided attention. And that's the most complex type of attention that a person uses, with simultaneously responding to multiple tasks. So we can see difficulties when we're feeling anxious and dealing with a mental health disorder of anxiety, that it's very difficult to attend anywhere along those levels of attention. Memory may already be a challenge for brain injury survivors, but anxiety may compound the issue, making it difficult to encode the memory or store the memory or what what has just been learned, or even retrieval of that information, you know, when you're feeling that anxiety and that emotion is getting in the way. Executive functions of planning, organizing, self-inhibiting, and skills that translate into independent living may be compromised with anxiety present. Therefore, it's difficult to do those things because they require higher level skills. So when we're feeling anxious and dealing with a brain injury, that makes it quite challenging. And then I also include that loss of independence when we're dealing with feelings of anxiety and also coping with brain injury. It's noted that both anxiety and depression, and we'll talk about depression next, they are common after having a stroke. And remember, stroke is also a type of recognized brain injury. They are associated with increased mortality and poor functional outcomes. And this is from Winstein in 2016. And this research, and I have this in my references as well, but this was developed as the guidelines for adult stroke rehabilitation and recovery from the American Heart Association and American Stroke Association. So they have guidelines that were put forth on what is optimal care for people recovering from stroke. And they recognize that anxiety and depression, because they're common, they do factor in on how somebody recovers from a stroke. According to the DSM-5, mood disorder no longer exists as a category, but it's now specified with bipolar or depressive disorders. And we will focus on the depressive disorders due to high prevalence for survivors to be dealing with depression. So criteria for the DSM-5 on depressive disorders is included on the slide for diagnostic purposes. So when they're looking at, does somebody actually have a major depressive disorder, these are the things that they're actually looking at regarding the symptoms. So not only is there an emphasis on mood, we also have emphasis on the thoughts that are going on, and then behaviors and actions that are being observed with the person or being reported by the person. So it's not just feeling sad, but we're also looking at, you know, is there loss of energy, feelings of worthlessness, difficulties concentrating, suicidal ideation or attempt. So we're looking at all those different things clinicians are when they are diagnosing. And we also know that it can often co-occur with anxiety or also the substance use. Intersectionality with brain injury, it is noted that major depressive disorder is the most common mental health disorder with brain injury. Like I said, anxiety is the most common mental health disorder, but we're seeing depression more commonly with somebody who has survived a brain injury. I would also like to point out the connection depressive disorders have on the Rancho Los Amigos scale. So these are the scale of where people are at in their recovery process. But when we're looking at levels 8 through 10, where the survivor is becoming more independent and as a result is experiencing more signs and symptoms to be diagnosed with depression. So, you know, when you're aware of and acknowledging impairments or things that are challenging, it interferes with task completion, requiring standby assistance to make appropriate action. You know, we may see more frustration or feeling easily angered, because you got to keep in mind that these are things that maybe came very easily to the person before, and now they are aware that it's more challenging, and that might trigger more feelings of depression. So you'd think, oh gosh, you know, look at my loved one or look at my patient, they're getting so much better, this is wonderful, why could they be depressed? Look at how well they're doing. But keeping in mind that for them, life has changed, trauma has occurred, there's grief and loss involved, lingering challenges, concerns about the future, etc. And that can definitely impact those feelings of depression, perhaps to the point of actually being diagnosed with major depressive disorder. But regardless, and this is just a small little sidebar, is that recovery from mental health disorders is possible. It's just acknowledging it and getting the treatment necessary. So the Diagnostic and Statistical Manual of Mental Disorders, and that's the DSM-5, they grouped substance abuse and dependence into just substance use disorder. So you're going to see that term very commonly used when we're talking about drinking, drugs, use of prescription medications that are off-label. Substance use disorder is continued use despite the health, psychological, or social consequences, and that's from the Brain Injury Association of America from 2016. Substance misuse might be just involving drinking too much or using illegal drugs. So we don't see that as problematic, but nonetheless, that is something to be aware of if somebody is experiencing some, or you're observing people experiencing substance misuse. It can actually translate or eventually become substance use disorder, depending on what else is happening with the person in their environment. So survivors of brain injury are often encouraged and educated to refrain from substance use, but depending upon the environment, keeping in mind the people they're with, the context in which they live in, that might be pretty difficult to stay away from substance use, especially in areas where substance use is part of the culture, which if you live in North Dakota, you're probably well aware that this is unfortunately part of our culture. It's how people socialize, it's how people connect. But for people that are recovering from injury, I mean, they really want them to abstain. There's a tenfold likelihood of resuming substance misuse after brain injury, even with the education and the encouragement to be free of substances. There is also a higher frequency of substance use and misuse. And unfortunately, with a return to use, we see an increased re-injury risk. So having another brain injury, possible suicide attempt, and also decreased life satisfaction. So we really want to encourage our loved ones, our residents, to remain free of substance use because it's better for them in the long run. Quality of life, well-being, and just bringing them back to that optimal mental health. Perhaps also fascinating to you as it is to me, personality refers to individual differences in characteristic patterns of thinking, feeling, and behaving, with a focus on motivation and psychological interactions with one's environment. So according to Mayo Clinic, we see here that personality disorder involves a lasting pattern of emotional instability, unhealthy behaviors, and it causes problems in life and relationships. Personality is thought to be generally fixed, but it's actually also now being seen as more malleable over time. And it might also be dependent upon the environment or the context that the person is in. So I guess the good news is that if somebody has said you've had such a fill in the blank type of personality, you can actually change that. And it might also be dependent upon what situations that you're involved in. Now with a personality disorder, we're looking, and like I said, with the intersectionality with brain injury, 23% of persons with brain injury also had a personality disorder. And personality disorder pre-injury, so before the injury, maybe more pronounced and challenging after the injury. And that's something that we've recognized, or that I've noticed in working with people, is that personality may change after injury and may change over time, especially as people age or the context changes. But more than likely, there may have been a personality disorder pre-existing, but we see it more, we acknowledge it more after the injury. It just becomes more apparent. Now, when we pair personality disorder with other mental health disorder, then we also see more of a disruption with social occupations, independent living skills. So knowing that some of these can be co-occurring, it makes it more complicated. If you're also dealing with a personality disorder, but also feeling depressed and dealing with substance use. So it does compound the problem. However, I want to just reinforce that recovery is possible with proper diagnoses, proper care. I also am a huge, this is a bit of a tangent, but it definitely does relate, the cognitive behavioral standpoint, and we'll talk about this a little bit when we get into rehabilitation and interventions, but thoughts and feelings are driving behavior, therefore action, and it cycles back to the development and expression of personality. So that's all very connected as well. But with a brain injury, shaping personality intentionally might be challenging due to the injury. Okay, so I think we have all deserved just a little quick stretch break. Okay, so it's time to literally move and stretch a little bit. So this is helpful for our bodies and brains. So certainly do what you need to do if you need to get up or lift your arms up, but just to stretch a little bit. And I'm just going to share just a few words of wisdom related to this topic and how you can change your thoughts to change your life. You know, going back to that cognitive behavioral, our thoughts shape our view of the world and therefore how we choose to interact with it. So very powerful. Use of person-first language. So we've probably heard this before, you know, use person-first language, you know, don't say the depressed patient, don't say, well, the addict. Right. We're not supposed to say those things, but nonetheless, even working in mental health for as many years as I have, I still hear it from people that work alongside me. So it's important to catch people as they're saying those things and politely provide alternatives. So the person who has depression, or the brain injury survivor, or survivor of brain injury recovering from the substance use disorder. And you'd think, you know what, is this really that big of a deal? It is. It might be easier to say the short phrases, but it's so damaging. It's labeling. It's not helpful. So I want to encourage you, don't cut corners in your communication. If you do, you'll have some damage control to engage in later. So person first language, person first in our interactions with folks, keeping that in mind. I also hope that you sense that at this point you've learned about some of the mental health problems, mental health disorders, but I hope you sense that mental health matters. We all have it. We all have mental health. It's integral to our very being and also our well-being. And I think when we learn more about mental health problems, mental health disorders, and we view it as a continuum, we realize that it's always with us. We realize that it's always important. And I just think it bears repeating that it matters. The last thing on our quick stretch break as we are getting settled in again is always have hope for survivors. And I oftentimes use the term survivors because somebody that's undergone, whether it be a mild injury, moderate, severe injury, and there's a quote coming up on one of the slides from a survivor that I know, but they're here, they're living life, they're contributing to society in every possible way that they know how. And as caregivers and staff members, we are helping them with that contribution. We need to have hope for survivors. It doesn't matter if their injury was a year ago, 10 years ago, 30 years ago. They're here, they're part of our world, and to have hope for them to contribute. You can't not have hope. And that's just so true. If you don't believe that your loved one, your resident, you yourself can get better, our motivation can quickly fade. So we can all hold on to hope. Maybe it's not a miracle for healing, but at least it's little steps forward every day, living the best life possible. So that's my rah, rah, rah moment. You should feel good now, having hope, mental health matters, and that you will always use person first language. And if you are noticing somebody isn't, to politely correct them in that. So what we're going to do next is apply the information on optimal mental health and how it can help in the recovery process for brain injury survivors, as they also address their mental health problems and/or mental health disorders. So we're going to ask some critical thinking questions to help identify barriers, because we could just lay out, or I could just lay out, okay, this is what you need to do. And we will talk about what's optimal, but what are the barriers? What are people dealing with that gets in the way of helping somebody recover from a brain injury? And it's actually quite surprising, the things that can get in the way. So let's kind of get those out in the open. First of all, keeping in mind mental health, brain injury, we have substance use that some of our residents, family members struggle with. So looking at how do we help them deal with cravings? How do we help motivate? How do we help encourage? Why is it difficult some days? Cognitive functions, we've talked a little bit about that already, and how a brain injury does affect our cognitive abilities, our emotional responsiveness. That's difficult. That can get in the way. Physical disability. There's a saying that not all injuries are visible. I think that's on one of our little, here we go. I'm digging in my desk and I found my not invisible pin. Like sometimes we think, oh, that person, you know, they must be fine because they can walk and they can communicate. They must not have an injury. It must not be that bad. But when you talk to people, when you get to know them, you understand that, you know, there are things that they're dealing with. So keep in mind that just because you don't see something as a disability or a struggle doesn't mean it's not there. But folks that also have physical disabilities are also dealing with that as well. So that can make it difficult to recover from injury. There's a feeling loss of independence and grieving that loss. And that's something very important to acknowledge, is the grief cycle. Where are people at in grieving the loss? And knowing that within that cycle, people can seem like they're quote unquote over it, you know, they've moved on, and then they're going to have a day where they're grieving again. And that's just part of being human. I think many of us do the same thing, where we have days that are more challenging than others, and just acknowledging where we're at in that grief cycle and working through that. Depression, anxiety, personality disorder, I could keep adding to this list on and on and on. But those things get in the way of helping somebody recover. So now we've got that out of the way. I also do want to make a comment on the environment, people, and self. Okay, this is a big one here, because we think that, you know, we have a conducive environment that's going to help people with their recovery, but this might not be home for them. Home for them is back home. It's not in the skilled facility. It's not in the basic care. It's not in the inpatient rehab. It doesn't feel like home. And sometimes that can be troublesome to them. It just doesn't feel right. And that can impact the rehabilitation process. The other people, so the other residents that are also there, that can impact as well. What are the routines? What's the milieu like? Is it changing all the time like it is in facilities, especially larger facilities? Or is it pretty static? If you are a caregiver at home, your milieu might be pretty routine, pretty static. There's not a lot of people coming and going, especially right now with COVID and trying to be socially and physically distant. So that has an impact on brain injury survivors and their rehabilitation process. Sometimes the environment isn't as enriching as we would like, and then other times it's too stimulating. There's too much going on. So trying to strike that balance, knowing each person is different. The people that are involved, so staff that are trained, family interaction, caregivers. I will say that even those with the best intentions can still occasionally get in the way of rehabilitation for survivors, especially those with mental health problems or disorders. Yes, trainings are helpful, like this one, which I hope you find is helpful, but time with your residents, time with your loved one who has sustained a brain injury, developing rapport with them, getting to know them, listening to them, that's where the change happens. Everybody is an individual. People will have good days. People will have more challenging days. So keeping in mind that mental health, we always have to be thinking about that. What's happening with mental health, and also mental health problems, mental health disorders. Are we doing everything we possibly can to help the people that we're working with? You will likely have to adjust your therapeutic mode and how you work with each resident, keeping in mind their rights. And in long-term care facilities, as in other facilities as well, residents have rights. There's things that they are able to do, but keeping in mind some of them may have a guardian. So how do you involve that guardian while still respecting their rights? It's policies, it's regulations, and it's not easy. All of this is so difficult, but don't give up on those that you care for, because they need you. So be a catalyst, be people that are willing to help and to learn and to work with people. Don't let you yourself be a barrier. Family interaction and caregivers, you care personally and perhaps also professionally, and that can be taxing as well. So taking good care of yourself, that will help you take good care of your loved one. The last one is self. So to the survivors out there listening, okay, can we really expect someone to be motivated all the time in their rehabilitation journey? Or when we want them to be? You know, I'm a therapist, so there's when it's therapy time, I hope people are motivated. Will they always do what we want them to do, even if it's good for them? Can we expect them to always follow behavior expectations? Can we really expect that? Especially for those of us working in facilities, we have expectations, we have, like I said, rules, regulations, policies, all that to follow. But in your own home, caregivers and staff, do you always follow expectations in your own home? Likely not. So while we can encourage this and help survivors work through their challenging moments, they're still going to happen. Okay, so keeping that in mind. So what constitutes an ideal rehabilitation setting? I'm sorry I spent time talking about what are the issues, but what are we looking for? What do we want that's really good? So we want communication. This is huge in healthcare at all times, especially during times of stress like we're going through right now with the pandemic, but excellent communication. We want to see coordination. We want to see collaboration on behalf of the resident or the family member getting the best care possible. That's huge. And what does that look like? Well, it's quality care. And that is multifaceted. When you look at the guidelines, like I mentioned, from the American Heart Association, American Stroke Association, those guidelines talk about what is best care. Looking at all the evidence available, what is best care, what is quality care? I do encourage you to check out that resource. That's an ideal rehabilitation setting. And I do assure you, with my involvement with a project that we're doing nationally to standardize quality of care, I'm excited for the work that's going to be coming out so that people know what quality care looks like and facilities can aspire to that. So I want to share the quote at the bottom. This is from a brain injury survivor. Says, I want to inspire people. I want someone to look at me and say, because of you, I didn't give up. So powerful words. We'll carry them with us to the next slide. So this quality of care that I'm talking about, I want to look at it from a programming standpoint with respect to brain injury and mental health, because hopefully some of these features are included in programming. Keep in mind facility programming, but also programming that you yourself do in your home if you are a caregiver for somebody with an injury, or if you yourself are a survivor, some of the things that you can look forward to doing. So with counseling, the team should know So whoever your treatment team is, they should know what techniques are being utilized and work towards continuity of care in the approaches used. So counseling and education, especially with people who are also dealing with substance use disorders, mental health disorders, we see this quite frequently, the counseling piece. This could be specifically for substances. It could also be general counseling. It could be specific to family or grief counseling, but it's important that we tap into those resources, and that's what they're there for. We are fortunate here at Dakota Alpha to have a contract with Heartview. And so we do have a counselor that comes in and does individual sessions. And when we're able to, we also do groups. And that's just so helpful for the residents. They really get a lot out of that. Looking also at some of the techniques. Behavioral. So how do we shape behavior for some of our residents, and how do we use cognitive behavioral techniques? So how do we help them look at their thoughts and feelings, and how does that shape their behavior? And then also motivational interviewing. So motivational interviewing is really to elicit behavior change, and there's such a focus on empathy and empowerment. It's asking the right questions and really spurring people to action and making them own their actions. So that's a really great technique that has been helpful with survivors. I do want to just circle back to the importance of continuity of care when it comes to counseling, when it comes to education. Information, if a counselor is working with a resident, making sure that if a technique is really helpful, it should be shared with the team. Not sharing the information or the family member, and keeping in mind if there's releases of information, making sure that that's all kosher, but sharing what are you working on, because we are, the rest of us on the team, myself as an occupational therapist, I want to know if there's anything I can do in my sessions that will complement what's happening in counseling. So keeping in mind that we're providing continual education, and that's something that is key across, quality care, that education's always occurring, whether it be written, verbal. We're always learning. And that's noted at the bottom of the screen as well. If you're not willing to learn, no one can help you. But if you're determined to learn, no one can stop you. Survivors do want to be involved in their care. They want to know the risks. They want to know the benefits. They want to know what's going on. Make sure you tell them. Groups are important with programming, and while not all people are extroverts and prefer the groups, they do have their place, because humans, we are social creatures. So at Dakota Alpha, this is before COVID descended, we did psychosocial group topics. So we would have groups on optimal communication, goal setting, how to deal with anger, what do you do when you're encountering change, what does it mean to be a survivor? So there's a focus on the self, but also on forging connection with others. So the goal is in a group that the attendees get something out of it, but also that they themselves are seeing themselves as contributing to others' recovery process as well. Groups can also be social with an emphasis on pragmatics. So our human interaction in thoughts and actions socially. I also included on there the importance of AA and NA with your programming, especially for people that are dealing with substance use. Exercise. So this one we see a lot in studies involving optimal coping skills. But wow, it has a value for being incorporated into daily lifestyle habits and routines, wards off potential stressors, lessen the effects of stress. This was also noted in Winstein's work with stroke survivors. So this is a complementary treatment option for post-stroke depression. So they're saying this is good. You should be exercising. There are feel-good endorphins, goodbye to the stressful cortisol in our system. So it has that physiological benefit, but it also has a social component. When people are exercising, even if they're in the same room, maybe they're interacting, maybe they're listening to music, there's a benefit to that. It's social. But keep in mind, exercise is also physical. So we're gaining strength, working on balance. If you're able to, getting outside. So that can also kind of have like a spiritual sense, like being connected with nature, or being connected with your higher power. So exercise is just great to see across the board for mental health, also dealing with mental health problems and also mental health disorders. So we see that one pretty strong and prevalent. And then lastly, coping skills. We know that this is important, but identifying what are the stressors. Do you know what's causing the stress? How do you know? What are your signs? What are your symptoms? What coping skills work for you? So developing coping skills, identifying what works, and then doing it. And stress prevention techniques. So what can you do? What can you build into your routine that's going to help you prevent stress? How can you make things better? So these are great considerations within programming. Like I said, in a facility, if you're working in a facility, if you're doing outpatient, how can you incorporate some of these things with what you're already doing? If you're at home, how can you incorporate some of these things? If you're a survivor, what stands out to you? What would be helpful to you? But I think it's great that there's options. I think that's the biggest thing. So as a reminder, well-being and quality of life are recognized with the confluence of optimal health, the environment, and occupational participation, a mixture of those three. So being in a state of well-being helps buffer effects of stress. So we're able to cope, boosts our self-efficacy, believing in our abilities. So in general, are survivors being cared for in all areas of their health? Okay, so what can you do to promote well-being? Okay, how are you creating optimal health in your environment, in your home? What about occupational participation? Do we need to branch out more, do more exploring of meaningful things that we can incorporate? Is the environment, physical, social, cultural, is it conducive to recovery? So keeping in mind that when I talk about the environment, we're thinking about the physical layout. So your home, the facility, are things accessible? How supplies available, temperature? What about social expectations of behavior? Are rights of residents being promoted? What about the culture of the people in your facility? Are they being respected and promoted? Okay, so it's a lot to think of. And like I said, always having in the back of your mind, okay, mental health, how does mental health work into this? What about my residents or family members who are dealing with depression? How do I make sure I'm addressing everything? How do I make sure I'm looking at it from all angles? Are there just right challenges for survivors to participate in with occupations? So that includes activities of daily living. So how can I help somebody be more independent as they brush their teeth? How can I connect somebody with a service that can come in and help them set up their medications? Are we doing enough for leisure? Are we having enough activities and fun things to do? Pursuing education, return to work programming. So all these different things that we're thinking about. So in my dissertation, one of the key assertions made with the population that I studied had to do with this pervasive promotion of self-care. So not just in times of stress, okay, but it's the recognition that mental health is always with us, and we should be doing what we can to remain on that end of the continuum. So this includes survivors, caregivers, and staff. It should be part of our discussion so that routines can be developed with self-care. So can you set aside time for self-care within your day? And I feel like self-care is such a buzz term right now, but are you setting time aside to care for yourself? Are you doing that? When you're at work, can your 15-minute break be used for some self-care? Can you go for a quick walk outside? Would that make you feel better? Those little things might help bring us away from a mental health problem back down to improved mental health. At this time, I can't say enough about validating feelings, experience, and communicating care and empathy. With the increasing social and physical isolation, many people are struggling mentally with COVID and the pandemic. However, people with a brain injury, those living in congregate living situations, they're even having a more difficult time. We owe it to the people that we serve, whether it be our family, our residents, we owe it to them to be kind. We owe it to them to explain what's going on, providing information, validating their feelings. There have been a lot of changes in recent months, and that can be extra difficult for survivors and those that have a mental health problem or disorder pre-existing to this pandemic. So I want you to ask yourself, how are you helping? How are you being part of the solution? So our survivor quote here, we might be in a wheelchair or have to use a walker, but we are still alive and breathing. And as long as we're breathing, we should try to do as many great things as we can. Never give up, refuse to sink. I just love the emphasis on ability and persistence. Okay, so let's face it, life is tough right now. So whether you are a survivor, a caregiver, a healthcare worker, or just a fellow earthling, we all owe it to ourselves to do some self-care and focus on our mental health and our well-being. So that is what we're going to do right now. So I want you to grab a pen and a sticky note, or you can actually open your cell phone to notes if that works for you, and you can just type right into your phone or your iPad. So I'll let you get that ready. Okay. So before we write anything, I'm going to just talk a little bit about what each one of these is and what's the benefit. First of all, emotion-focused coping. This type of coping skill is what helps you and makes you feel better now. So if you are feeling stressed, something all of a sudden happens, or you learn about something you have to deal with, or you're in a hurry and just one thing after another, what makes you feel, if you could just stop, what would make you feel better right now? It has to be healthy, okay? That's the key. It has to be healthy, something you can do, something accessible. I think we'd all love to snap our fingers and be somewhere warm and tropical as a winter storm is on the horizon for tomorrow, but probably can't do that. So what makes you feel better now? Can you talk to somebody? Take a deep breath, say a prayer. Do you need to just walk away? Do you need to walk away from the situation? So write down at least one emotion-focused coping skill to reduce stressful, emotion-infused situations. Another type of coping skill is called a problem-focused coping skill. And this is really answering the question, what will help you solve the stressor or the feeling of stress? So where an emotion-focused is really just in the moment, what can I do to feel better? Problem-focused is looking at over time, how can I make this better? How can I be a catalyst to solve what's going on in the stressful situation? So what some people have found helpful is to make a pros and cons list. So if you have a decision that's really wearing on your mind, or something that's just bothering you, could you journal about it? Could you write it down? If you can't write it down, can you talk to somebody? I would hope we all have at least somebody we can talk to. And luckily with, I guess if there's a silver lining with some of this pandemic, I'm going to say it made us more aware of our technological advances and how we can be connected. Zoom, Duo, FaceTime, Messenger. Okay, you have options to connect with people. Setting a goal might help with problem-focused coping. Okay, so thinking about how do you solve the problem, not just what's going to help me in the moment, but what's going to help me over time. We also have stress prevention. So writing down at least one stress prevention technique to help keep stress low. So with this in mind, I want you to think of stress prevention as like a shield. So what can you shield yourself with that will help keep the stress away from you or help prevent its effects on you? And luckily, there's a lot of things we can do, and probably things you've done today already, and you did them and you didn't even realize that they were a helpful stress prevention technique. So did you do some exercise today? Maybe you've already done it, maybe you're planning to do it. That's a prevention technique. Remember, exercise makes us feel good. It should be part of programming. Are we eating healthy? We don't have to, we don't have, this is my thoughts, my thoughts here, okay? We don't have to eat healthy 100% of the time, but are we being mindful in our eating? You know, are we choosing healthy most of the time? Okay, because when we get somewhat restrictive, and we didn't talk about that, but it is a possibility for some injury survivors that their eating does become disordered, either psychologically or physiologically after their injury. So making sure that we're eating healthy most of the time so that we aren't falling into some disordered eating. Getting a proper amount of sleep. So how many hours of sleep did you get last night? Was it good for you? Or do you wish you could have had a few more hours? Journaling can be a good prevention technique. So journaling on a daily basis. If we journal like only when something's going on, we're probably using it more as a coping skill. But if we journal on a regular basis, we can track our emotions, our thoughts, situations over time, and then we develop insight and we know how to handle situations better in the future. So journaling can definitely be a great stress prevention technique. Fostering social connections. I already talked about the importance of reaching out, connecting with people, and that's a prevention technique as well. You know, who are your people? Like that video said, who's in your corner? Who's in your corner that can help you? And fostering those relationships. So what you should have now, either on your sticky note or in your phone or on your iPad, are at least 3 good types of coping skills and prevention techniques that will help you when you're encountering situations. And like I said, the goal is to look at the continuum. How can we spend more time in mental health, less time in mental health problems? And if we're dealing with a mental health disorder, how can we effectively treat it and recover from it to move us back down into maybe just encountering mental health problems or even returning to what is our optimal mental health? As we close here, I did want to point out a couple other things that I think are just very important overall when we're dealing with and looking at this topic, because it's the intersectionality of brain injury, but also mental health, but emotional intelligence. You've maybe heard that term before. So being able to read emotions in situations and in people, that's so important. And having excellent communication skills to get to know the people that you're working with, to reestablish connections with family, people that have survived a brain injury. That's definitely important as well. And also keeping in mind not to energize situations you don't want energized. So where are you putting your time and efforts? Are you putting them towards helping? Are you putting them towards empathizing? Are you putting them towards those optimal rehabilitation ideals that we talked about with programming? Are we putting our energy towards that? I certainly hope that we are, instead of towards things that are counterproductive or don't help our residents and our family members move towards recovery. Like I said on that previous slide, we have to have hope for the future and what's to come. So making sure that we're energizing the right things, putting our time towards the right things in order to do that. Little print here, but necessary print. Some of the references I used throughout presentation today, I just think it's important for you to take a peek at those, and if there's anything that you want to follow up, to certainly be able to do so. But at this time, I will turn it back over to Carly and see if there's any questions or anything lingering out there.
Yeah, thank you, Aly. That was great. I appreciate like the action steps and the stretch breaks and things. That's awesome. Yeah, does anyone have any questions? You can either turn on your microphone to ask a question. You can just type it in the chat box if you want me to read it for you. Either way. Good.
I didn't include my email, but I think that's important. I'm fine with sharing that as well. So if somebody has a question after the presentation on anything that I spoke about, or any other lingering inquiries, I'm definitely open to entertaining those. If I don't have the answer, I'll certainly point you in the right direction, because as you can tell, I think it's so important to keep open lines of communication and always be learning and seeking education. So,
want me to put it in the chat for you there?
Sure, that would be great.
Question.
Perfect. Hi, Skip. Yeah, go ahead.
I don't know if I worded this right, but when Aly, you spoke about the groups and the sessions of like the NA and AA sessions like that, when people go to those.
Mm-hmm.
Okay, yeah. And the group psychosocial, yeah, the AA and NA, is it possible, do they recognize when they're in those groups, is it, how I say, do they recognize the person who's had head injuries that's in those groups, or do they just not recognize them?
That is an excellent question, and we've actually ran into that as well with one of our former residents that was attending one of those groups. I don't exactly know if there's groups specifically for people that have survived a brain injury, but I know that if the, for example, Heartview, if they're made aware that that person is dealing with that, they've been great about being able to perhaps offer alternatives or be able to break down the information in a way that's better understood, or spending extra time. So I feel like, at least with my experience in working with Heartview here locally in Bismarck, Mandan, they've been good about helping people, making sure that it's presented and they feel supported in being part of those AA and NA experiences. But as far as our community or even across North Dakota, having groups specifically for people that are dealing with that, I'm not exactly sure. So I'd have to look into that. But that's a great question.
It's like, oh, okay, because it seems like some of them, I have family members who've had head injuries to AA and stuff like that, and it's like they're not, I'm not, what do you call, recognizing that they have had these head injuries.
Mm-hmm.
They're dealing mostly with just the addictions.
Right. And I think, gosh, I mean, anyone that's coming into those groups are dealing with so many other things that they might not even be aware of. But when we think about somebody that survived a brain injury, it has affected them emotionally, cognitively, perhaps physically. So they're bringing all that to those meetings as well, and to making sure that the group is, you know, they don't have to know all the details unless somebody's disclosing that, of course, on their own, but to be respectful of that and making sure that they're doing what they can to adapt the content so that they're still getting as much out of it as they can.
Okay, thank you.
Yes, thanks for the question. Any other questions?
Hi, this is JP.
Hello.
Hi, just want to let you know that I really like some of the sayings that you have underneath, especially that one that we're looking at now about learning or not learning.
Thank you for that feedback.
It's very apropos.
Yep, and the survivor that shared those quotes with me will be happy to hear that positive feedback.
All right, thank you.
Yes, thank you.
Anyone else? I did put her email address in the chat for you. For those of you looking for CEUs, the request should be up at the end of the by the end of the workday tomorrow on the same page where you find the recorded webinars and the new ones as well. So fill that out and get you your CEUs as soon as possible.
It was a great presentation. Thank you.
That was, yes. Good job, Aly.
Yes. Thank
I
you
really
all
like-
for.
Yep, I really like that too, Aly. And then I really made me feel good when you mentioned people first language.
Yes.
We started that people first language when I worked for a people first group out of Bismarck, about, geez, quite a few years ago. And when I kind of correct people, they kind of look at me a little sideways about people first language.
Yep. But kudos to you for politely correcting, because that is so, it's just so important. And it just makes my, it just lights a fire in me. It lights a fire in me to say something and, you know, making sure that people are given the respect that they deserve. So thank you for pointing that out, and thank you for doing that.
Sure. I got another question, Aly.
Mm-hmm.
On, let's see, with that anxiety, you talked about having anxiety and depression. But in the groups, do they, because that's another one that I've got a family member who's really suffering with anxiety issues, and they call it psychosocial.
Mm-hmm.
But I mentioned to her, you've had head injuries, and she said, yeah, a long time ago, but it seems like her counselor, her group doesn't really focus on it or share anything about it. They just mostly work on her anxiety, but then she withdraws, and it's hard for her to, I don't know, I feel like she's not getting the full benefit of her counseling because of they're not recognizing her head injury.
Mm. Yeah, and I'm sorry that's happening, because it, like I said, it's when we're entering into a counseling environment, whether it be group or individual, we're not just bringing like one part of ourselves, we're bringing all of ourselves into that experience. So I would just encourage her to be an advocate of, you know, these are the things that I'm going through. Let's make sure we can address this fully, and just trying to be as forthcoming and, like I said, as big of an advocate as possible, so that she gets what she can out of it, and making sure that they know, you know, if they've glossed over something or if they need to, you know, come back to a topic, it's okay, you know, just let us know. That's how I've, you know, tried to, when we've done our groups here at Dakota Alpha, to, you know, take it slow, and really when you get to know people, you kind of know what they're looking for, and then can also follow up with them on the side and say, is there anything else? You know, what are things you're interested in? Do you feel like we're addressing this enough? So I just encourage her, you know, to be an advocate. And if you can help be a voice for her as well, if she's open to that, I think that would be great to make sure she gets out of it what she absolutely can.
I think I am, because she'll message me and she'll tell me it's because of me, what I've done. She's continuing. She's not given up. She said she'll be 28 at this month.
Wow. So she's a survivor. She'll get through it.
Mhm.
This is for Carly.
Yes.
After this meeting here, if you're still at work, you should have my cell phone number. Give me a call. I have a couple of questions and hopefully something to give or send to you or give to you.
Okay. Sounds good. I'll do that.
Thank you.
Yes.
So I guess I'll just, I'll tie up my part and then I'll turn it over to Carly. I just want to thank everybody for taking time out of your busy Wednesday to join us virtually. I appreciate you, you know, really absorbing and being interested in this topic. It's definitely a passion of mine, so I'm happy to have shared it with you. If you have any questions, don't hesitate to reach out. You do have my email that Carly provided. But like I said, I just want to thank you, and thanks for bearing with me on a couple of our small technical difficulties. I'm glad we were able to overcome those and go forth.
Sounds good.
Thank you.
That's all. I don't have much else for you guys. I just, you can do your CEU request online. And if you ever want to speak or have ideas on topics or you know a speaker, let me know. And yeah, thanks for joining, everybody. Have a great rest of the day.
Bye.
Bye.
Bye. Thank you.